Will AI be the downfall of our healthcare system, or its savior? In this interview-styled video analysis, we will be discussing the potentials and pitfalls of the integration of AI in healthcare. Topics like public health, business models, the restructuring of patient interactions, and so much more, will give you valuable and unconventional insight into the matter. For those of you who would like to skip the intro and jump right into the content, can start at the 1 minute and 33 seconds mark. Please enjoy.
How are you?
I'm well, thank you. How are you?
I'm doing well.
Good.
Awesome. So we're going to start this interview off first by just asking you what is your name, what is your profession, the position that you hold.
Okay. I am Alexis Powell Williams. I am currently a health educator focusing on social determinants of health and violence prevention for Guilford County Division of Public Health. I am also a part-time instructor for North Carolina A&T State University in the Department of Health Services Management.
Okay, awesome. So you have quite a few things under your belt.
I do.
Yes, ma'am. And how long have you been in the healthcare field?
I have been in the field of healthcare for about 12 to 13 years. I have been in the field of public health for about 3 to 4 years. I am still quite new to educating on the collegiate level. I've been with A&T for 1 year now.
Okay, that's really awesome, and we're really happy to have you as our professor.
Thank you.
Yes, ma'am. So what we're going to be discussing today is the incorporation of artificial intelligence and natural language processors in healthcare. So mostly just focusing on how it can widen the gap in health disparities amongst vulnerable communities. So you have a lot of experience and just knowledge and information regarding health disparities in vulnerable communities, and a very extensive resume at that. So let's just start by asking the first question. How do you think this will affect healthcare in general, just from your own perspective?
Well, I share a bit of a split, I would say, a bit of a split kind of idea about the use of AI or artificial intelligence within healthcare. While I do think on one hand it could be a unique resource for healthcare systems or healthcare professionals to use, just in regards to day-to-day tasks or how to kind of integrate technology or the use of technology in innovative healthcare practices or innovative treatments. However, I do recognize that there are some risks and limitations of computerized or artificial intelligence systems that might perpetuate or further perpetuate health disparities and health inequities.
Yes, so that's actually the main point. A lot of times when we talk about big like news-breaking discoveries or just advancements in technology, we're referring to the clinical aspect of it. So for example, they just found like a colorization of cancer cells. That's something that AI can now do. So it can just help improve different treatments, as well as CAT scans and just streamlining of workflow in general. But for the clerical side, it can be a little more tricky, especially for like privacy and just consent of sharing information, because that can be breached very easily.
Absolutely.
So you do agree with that?
I do agree with that. So while artificial intelligence or just the use of any technology really might be a great asset for us in terms of, again, providing innovative treatment methods or innovative diagnostic methods, there is still kind of that gray area in which we have to become more informed about, such as sharing data or patient security, protecting patients' health information, ensuring that patients' health information are not being shared across systems in which it's not meant to be shared. So there's that gray area or that area of unknown about the use of artificial intelligence within healthcare.
Okay, yeah. Thank you very much for your input. So that was on more maybe general surface level, but to get into the details, the finer details, when we talk about integrating technology into healthcare and how it might widen the disparities, we should keep in mind how low-income and rural populations who may lack access to advanced healthcare technologies benefit from AI healthcare-driven tools. Do you think that maybe access to technology might actually play a factor in widening the gap, or do you think that that will not really be much of an issue?
Now, when we talk about health inequities or health disparities, we are already acknowledging that a group or groups of individuals are being or have historically been marginalized or singled out or systematically oppressed. So we are already recognizing that this group is at a deficit or this group is not able to or have a hard time reaching optimal level of health due to certain systematic things that have been put in place way before now, or way before we have reached a point of discussing the integration of AI and technology. So when you say access to technology, now that is something that improves or has been discussed to improve patient health outcomes and reducing marginalization within groups. Just access to technology such as broadband access, or ensuring that every household, or including low socioeconomic households, has access to the internet and broadband access. Now, when we talk about using said technology within healthcare or within those groups that are already marginalized, that gets a bit tricky or it gets a bit muddy, I would say. There's not a lot of research about AI and how it might interact with information of those from different socioeconomic backgrounds or certain races, genders, ethnicities. But it does have the ability, I believe, to kind of identify certain markers of patient information, and it will do with that what it will do. The only thing is that it takes a humanistic approach to identify certain barriers within a person's situation. And I think the use of AI in certain situations in healthcare will minimize that humanistic approach or minimize the role of, sometimes it takes a person that is trauma informed or trauma trained to recognize when a person is facing various social factors that are impeding their health outcomes or decreasing the optimalness of their health outcomes. So I think I continue to say this, but I think we do have to be really careful about how we use artificial intelligence or any computerized systems within our healthcare practices.
Yeah, absolutely. That actually leads me into my very next question. So basically, do you think that AI algorithms are being, or do you think that they will be properly trained on diverse patients in different populations, like you mentioned earlier, people of different demographics, socioeconomically or gender-wise, or anything else?
I think it'll be a bit hard to train or develop algorithms that are without bias, just because we as a people have a tendency to bring our biases into everything.
Yeah, exactly.
So if these systems are still being programmed by or coded by individuals who lack a sense of health equity or a sense of the importance of health equity, or lack just cultural humility, then those systems will lack cultural humility. Those systems will lack the ability to be inclusive. So we can say we will train or develop algorithms to identify those things. However, we have to be coming from a place of non-bias, and that's a bit hard because as human, again, we tend to bring our biases into everything, whether knowingly or unknowingly.
That is a phenomenal point to make, actually. So thank you for your input on that. In addition to being that you are working more on the clerical side of healthcare, it's more of the business aspect that a lot of people really do not pay attention to, but it is incredibly important when we're talking about policies and just making things more equitable and accessible for all populations of people. What do you think that the incorporation of artificial intelligence or natural language processors will do for maybe the budget of healthcare organizations and entities? And do you think it will further increase the expenses of medical treatments or make the quality of care less accessible to uninsured or underinsured populations?
Well, there's a little bit more information about the use of AI programs in terms of business. We know that healthcare is a business, and it will continue to be for as long as we share this fee-for-service based care. But those AI programs they have the ability to kind of comb through knowledge and to kind of search, synthesize, and report information. They're very good at deriving process-based information and very good at developing processes or steps or identifying processes and steps in order to improve systems. So I believe that is probably the best use for AI in healthcare right now, to more so streamline healthcare operational processes or break down the best allocation of funding or resources within healthcare systems and organizations. I think that's where AI best fit right now. Do I think that sometime in the future, when we are more conscious of inclusivity and diversity, I think those computer systems can be trained in a way to identify cultural humility. But right now, I think its best place is developing systems or processes to improve healthcare quality or to improve the operational component of healthcare.
Okay, I think that was really well and eloquently put, and also something that I did not expect you to say. A lot of times when people think of AI and the business aspect of healthcare, they think more expenses is probably not going to be as affordable or going to have a good quality of work, as when it evaluates different patient information or things of that nature. It's not really going to do it in the best interest of humanity and more of the business. So, but your views on it are still, at this time at least, where its best would be probably clerical. And the expense part, do you think that it will actually increase the expenses, or do you think it might minimize?
Now, healthcare cost is a thing that I struggle with in healthcare. Healthcare costs in terms of per capita or per patient, the amount that households pay for healthcare, as well as the amount of that the United States spends on healthcare in total. I do think that AI can develop systems that improve healthcare processes. And if there's improvement within healthcare processes, I believe that will trickle down and improve health outcomes, improve treatment areas and such. When there are improvements within those areas, then we see a reduction in cost. When there are improvements in quality and quality of care, or when there's equitable access to healthcare quality, then we see the cost for the person or the individual start to decline. If I'm not spending so much on my healthcare or on the cost of medications or on the cost of visits, then I'm able to pour more into my household that's not being diverted or allocated towards healthcare costs. So now, in general, will we as a healthcare system or the United States spend less on healthcare by integrating AI into our business or clerical practices? That's a bit tricky for me. But I think because of how well AI is able to develop more streamlined or improved systems and processes, I think it will trickle down to reduce costs for individuals rather than, now would that look like for populations? I'm not sure. But for individuals, I feel like more streamlined treatment plans, more streamlined processes for staff to follow, results in fewer errors, more preventative plans that are in alignment with the patient's health or health history will lead to improved outcomes. That leads to spending less of their money, of their income on healthcare costs. So reduction in costs for individuals or household, but I don't know what that might look like for the cost in terms of population.
Yeah. Okay.
Does that make sense?
No, yeah, perfect sense. So focusing on improving the patient outcomes and their health, that is most important. And of course, AI will minimize these errors that humans may make, but then that also leads us to how this will affect maybe the job market for healthcare, employees. It might actually start to minimize because AI can do all the things that a person can do and be more efficient at it.
Absolutely.
So how do you think that might affect the job market and healthcare moving forward?
I think it would change the job market, absolutely. I do think it would change the trajectory of positions, different types of positions that are available within healthcare. as healthcare is a business, we have, analysts, or we have financial officers and such in healthcare spaces. Now, AI being able to detect certain patterns, say with claims information and such, that might reduce the need for certain financial officers within healthcare spaces. So again, it might change the trajectory of positions available within healthcare. But there's just certain things that require a humanistic approach. AI cannot do what our nurses can do. AI cannot do what our CNAs can do. So while it might reduce the availability of some positions, I think it will not change, or it will not have an impact, a negative impact on our persons in healthcare that provide direct patient care.
Okay. Yeah, awesome. I really, really appreciate that perspective. A lot of times, just in different fields in general, not just healthcare, people are mostly afraid. They don't want to lose their jobs. They don't know what the future will look like for them. They spent years in college or wherever they were inside their jobs, dedicating their lives to something, and then technology basically can just do it.
Absolutely.
In 5 minutes.
Right? It is. It's very scary. So, but I feel like systems or computers, they still require a human.
Indeed.
They cannot operate themselves, so to speak, and a human has to be able, there has to be checks and balances, right? If we use AI systems to kind of identify our patterns, say for insurance claims, see if there's any errors, etc., we still need a human to maybe process that report, to communicate that reporting to say our organizational leaders, or how do we communicate this to our communities to let them know that we're trying to find ways to improve the healthcare delivery payment systems. So while I feel like they still have to work hand in hand, there's a lot of technology that have been integrated into healthcare, but essentially it is still I don't want to say booming business, but it is still a very large employer for U.S. working Americans. So I don't think we have to fret very much over the use of AI in healthcare systems in terms of securing jobs, because I do think it's still going to be necessary to have people in these places to run, organize, and communicate the information that is delivered from these AI or computer-based systems.
Yeah. All right. Thank you so much.
Mm-hmm.
So how do you think that AI, since you've been in the field for so long, you've dealt with a lot of people, so you have a pretty good idea about how to deal with people and how different people will respond to different things. How do you think patients with lower health literacy or distrust for AI-driven systems may engage with AI and natural language processing tools, and so just the different communities and populations and how they might be affected by it?
That's a very good question. Health literacy or health education for populations or communities is an important component to, or an important factor that affects health outcomes. I think certain communities that have a history of being historically marginalized and presently marginalized or left out of certain conversations might have some hesitancy in terms of using AI systems, or in terms of using computer-based systems, just because when we have that history there, it's just kind of hard or to be accepting of certain types of things. Say, we're not talking about vaccinations and such, but it's similar to that. Vaccination is a certain type of treatment or a certain type of preventative measure that certain groups are hesitant about. Why? Because of history, because of being disproportionately impacted by disconsentful or trials that did not involve their consent in certain communities. So AI might be very similar. They might be hesitant about how their information is going to be shared if they use this system within their healthcare facilities. They might be hesitant about if they're going to get calls from X, Y, and Z or different persons because their information has been shared. Or they might be hesitant about how it might impact if we have this grand technology within our healthcare systems, how that might impact their bill. So there are really valid questions that I think are going to come from populations that have a history of mistrust for new, novel, or innovative things within healthcare.
Absolutely. And even not only marginalized peoples, but the boomer population, just older people who are not maybe as tech savvy and don't trust it. Like, hey, why can't I just speak to a person?
Right.
Or why can't a person just process my information? I have to go through X, Y, and Z just to get something very simple done.
Absolutely.
Yeah,
we still have those. I mean, I'm one of those people. I prefer to talk on the phone. Like, yes, I know I can use my chart to set an appointment. Yes, I know I can use my chart to request a refill. However, it's just something about that humanistic interaction within healthcare that is going to be needed, regardless of how progressive and futuristic we become. That humanistic approach is never going to waver within healthcare.
Yeah, absolutely. All right, well, thank you for that one. And then we kind of touched on this a little bit earlier, but just elaborating a bit more, specifically, how do you think the lack of cultural competence in maybe these future systems or potential systems could result in like poor communication and misinterpretation for maybe like non-English speakers or those with different dialects?
Yes, when we mentioned cultural competence earlier, I would say yes, just because, again, these technologies like AI, they just lack cultural competence, and they're not able to recognize certain humanistic things or certain humanistic components regarding our patients. And so those with language barriers, there's already kind of like a barrier there for us as healthcare professionals or public health professionals. There's already that barrier there that contributes to some misinterpretation and communication. Now, the use of AI in terms of translating for our non-English speakers, that might be a helpful tool in healthcare. However, in terms of communicating, certain health outcomes or communicating certain health education, adding in AI might further complicate that barrier that already exists between non-English speakers and healthcare professionals, or those that speak a different dialect and healthcare professionals.
Okay. All right. And then do you think that certain populations of people are more at risk than others when it comes to using AI as far as their privacy and information?
Absolutely. I do think that some populations are at greater risk, just because consent is a major component to a patient's ability to stick with or adhere to certain health communications. And so I feel like if we already have that hesitancy in some of those communities that we spoke about earlier, then I believe that will be further perpetuated by the use of AI or artificial intelligence within those groups as well.
Okay, awesome. And just to play devil's advocate, one could probably argue that all populations are just as vulnerable as the next.
I agree that could be a kind of alternative or a different side of it. But when we think about healthcare in general, or when we think about people being at increased risk of having their privacy violated, I think about those that have low educational attainment. That's a group. Those of low socioeconomic status, that's a group. Those that are vulnerable in terms of education and economic stability, those are groups that I worry about their privacy will be violated just due to lack of health literacy, lack of understanding regarding HIPAA and other protections. If they are not aware of how their information may be shared, then they might absolutely agree to have their information shared, not recognizing the risk associated with that share, or not recognizing that there might be some risk associated with having their privacy violated or having their data shared in a way that they don't really understand. So in terms of ethnicities or races or genders or those types of groups, maybe they might share, the same type of, or they might share the same risk for privacy violations. But again, I worry about different groups, those being in our lowest socioeconomic class, or with those with low educational attainment, or those with physical or mental deficits or disabilities as well. Mm-hmm. Those would be our vulnerable populations for security, or privacy information being shared, private information being shared.
Mm-hmm. I'm really happy that you touched on that. I feel like a lot of people don't really understand how dynamic and complex that can be, mm-hmm. because AI, they think, oh, well, it can be for anyone. Mm-hmm. But it's really important to really just emphasize those things.
Absolutely. And there's so many differences amongst people, and I think sometimes we get caught up on those key differences that we can visually see, like race or gender or age. But there are other limitations that we cannot see. Mm-hmm. We cannot readily see with the eye, such as when a person walks in, you don't know if they're in a low socioeconomic household or not. AI might not be able to determine that by their chart or by their health history. So we have to be considerate of those things as well. Mm-hmm. Or when you ask about consent, or if it's okay to share your information with our partners, they might use terms like that. Maybe they'll give you a head nod yes, but maybe they really didn't understand because it was not put in a way that is communicable or understandable for them. Maybe they have just a 5th grade education, and while they might not reveal that to you and they might just agree, they're vulnerable for having their privacy violated because of lack of understanding.
Absolutely. Okay, and then lastly, this is a question that we more or less did touch on, but just for a more specific hit as we did earlier. Mm-hmm. So how might the automation of certain healthcare tasks affect jobs in underserved communities where healthcare jobs are crucial for economic stability?
Yeah, again, the healthcare system employs a lot of people from various communities, backgrounds, socioeconomic status. So I feel like while automation and technology might improve our healthcare systems or improve our processes, our operations in healthcare, I think it would impact certain jobs within healthcare. What those jobs looks like, not our jobs that provide direct patient care, like our CNAs, our nurses, or our PCAs. Not those jobs that we have to have a human do, but those jobs that are more behind the scenes, like those that help us uphold our systems, might be affected by the use of technology or AI. But I don't think automation is always a bad thing as it relates to jobs. I think it makes processes smoother, and I feel like there's other things, functions, or responsibilities that we can allocate to people within those positions that might be impacted by automation or technology in healthcare.
All right. Awesome. Thank you very much. I know that because of the topic discussing AI and natural language processors in healthcare, the tone for health disparities can make it seem a little negative at times. Mm-hmm. Of course, there are positives, but all in all, from your professional, viewpoint, with all things in mind, mm-hmm. do you think that integrating artificial intelligence and natural language processors is for the benefit of the overall health population? And do you think it's an amazing, innovative thing that we should definitely be excited for and just, get ready for?
I think it is an amazing, innovative thing that we should be prepared to mitigate the risk of. I think it can be used in various ways, and I think it should not be used in other ways. I think that it has amazing benefits, but I also think that it has very serious risk. So I guess what I'm saying is we have to discern where to use this amazing, innovative tool and where to protect our patients from this amazing, innovative tool. Mm-hmm. So I do feel like in some areas of healthcare, the the reward outweighs the risk. In other areas of healthcare, the risk outweigh the reward. And in those areas, we need to protect our patients. We need to protect their information. We need to protect our reputation with our patients, our healthcare facilities. We need to protect our reputation with our patients. Therefore, we have to be really good at discerning when to apply or use this tool and when not to. I think it can absolutely be a great asset to innovative healthcare approaches, like I said earlier, in the areas of treatment and diagnosis and identifying patterns that we can avoid in terms of making human errors. But I feel like in terms of protecting our patients' health information, in terms of coming up with real comprehensive plans for our patients' health, that requires a humanistic approach that we cannot train a artificial intelligence system to identify with. So in some areas, yes, amazing innovative tool. In other areas, amazing innovative tool that we have to identify the risk associated with.
Absolutely. Thank you so much. Before we end off, is there anything that you would like to say, maybe in regards to shed light on this topic or matter?
I'm sure. I just want to emphasize that health disparities and health inequities are a phenomenon that do not just happen by chance. Health disparities exist in groups that have been and continue to be excluded from crucial conversations within healthcare and public health. I think we are at a place where we are increasing our conversations or increasing our awareness about health disparities and how it impacts different groups. But I think we have a long way to go. And so the use of AI, we don't want to do anything to make that long way to go even longer. We need to be very conscious about how we approach health inequities and health disparities, and how we do not need to misalign from where we're headed in terms of inclusivity and reducing health disparities. So if there's any risk that the use of AI is going to further perpetuate lack of cultural awareness, lack of cultural humility, then we need to stay away from it. If there's any inclination that there is going to be a further perpetuation of health disparities via the use of AI, then we should absolutely stay away from it in certain areas within healthcare. That's what I like to emphasize.
All right, awesome. Thank you so much for your time.
Thank you, Amaya.
Much appreciated. Hello, everybody. My name is Amaya, and if you made it to the end of this video, I just want to say thank you so much from the bottom of my heart. Now, I, of course, was the interviewer, and I hope that you found the content to be both valuable and insightful. If you're the kind of person who has a lot of interest, or you're just a curious person in general, I just want to say that I love that. I hope that you embrace that. I hope that you realize what your interests are and make an impact in this world, and just create the changes that you want to see. Thank you so much, and have a great day. Until next time.